There is a moment somewhere around 3 in the morning when you surface just enough to notice that your tongue is stuck to the roof of your mouth. Your lips are cracked at the corners. Your throat feels like you swallowed sand. You reach for the glass of water you now keep on the nightstand, because at some point in the last few years, keeping water by the bed stopped being optional. You drink. You blame the heating, or the glass of wine, or the pill your doctor put you on. You fall back asleep. And in the morning, your breath is sour in a way that brushing does not seem to fix. And your gums bleed a little when you floss, and you are tired in a way that 8 hours in bed did not touch. And you file all of it in the same place you have been filing everything lately, under the heading of getting older. I want you to consider something different. I want you to consider that those symptoms are not 4 separate problems that happen to arrive together. They are one problem, wearing 4 different masks. And the problem is not in your mouth at all. It is a few inches higher, and it has been quietly getting worse since your early 40s, and almost nobody is going to check it for you. Here is what is actually happening. For somewhere between 6 and 8 hours every single night, your mouth is open, not wide open, just parted, just enough. And every breath you take is pulling dry air across your gums, your tongue, and your teeth, over and over, roughly 8,000 times before your alarm goes off. To understand why that matters, you have to understand what saliva actually is, because most of us were taught to think of it as nothing. Spit, something you rinse away. Saliva is one of the most underrated protective fluids your body makes. It carries antibacterial compounds that keep the bacterial population in your mouth in check. It buffers acid, which is what stops the acid from dissolving your enamel. It carries dissolved calcium and phosphate, which it deposits back into the surface of your teeth in a continuous repair process that goes on all day without you noticing. Your enamel is not a static shell. It is a surface under constant attack and constant repair, and saliva is the entire repair crew. Now, here is the part that matters for you specifically. Salivary flow drops naturally at night. That is normal. It happens to everyone. It is part of the sleep cycle. So the hours you are asleep are already the hours when your mouth has the least protection. If you spend those hours breathing through an open mouth, you are not just reducing saliva, you are actively evaporating what little is there. The repair crew goes home, and the acid stays and works the night shift. This is why the damage from mouth breathing shows up in a very specific pattern, and if you have been to the dentist recently, you may recognize it. Decay along the gum line rather than on the chewing surfaces. Gums that are puffy and bleed easily even though you are brushing carefully. Bad breath that comes back within an hour of brushing because the bacteria producing it are anaerobic, they thrive without oxygen and without saliva, and they are having an 8-hour party every night. A tongue that looks coated in the morning, and a throat that is raw on waking and then feels fine by 10 in the morning, which is exactly the pattern you would expect if the irritation is coming from air, not from infection. If your dentist has told you that your hygiene looks fine but your gums do not, this is very often the missing piece. You are doing everything right for 16 hours a day and then losing ground for 8. So the next question is the real one. Why now? You have had this mouth your entire life. Why did it start falling apart at 47? 3 things converge, and they converge quietly. The first is estrogen. Estrogen receptors are present in your salivary glands and throughout the mucous membranes of your mouth. As estrogen declines through perimenopause and after, salivary flow tends to decrease. This is documented, it is common, and it is one of the most consistently overlooked symptoms of the menopause transition. Dry mouth is not on the list most women are handed. Hot flashes are on that list. Night sweats are on that list. The slow drying of the tissues in your mouth is not, and so when it happens, you have no framework for it, and you assume it is you. The second is that the same hormonal shift affects your gum tissue directly, making it more reactive and more prone to inflammation and bleeding with the same amount of bacterial irritation you tolerated fine at 35. So the insult goes up and the defense goes down at the same time. The third is medication, and this one is worth being honest about. A very long list of the medications commonly prescribed to women in their 40s and 50s reduce saliva as a side effect. Antihistamines, many antidepressants, certain blood pressure medications and diuretics, some bladder medications. None of these are wrong to take, and nothing here is a reason to stop anything your doctor has prescribed. But if you are on 2 or 3 of them and you are also mouth breathing at night, you are stacking 4 separate drying forces on top of each other and then wondering why your mouth feels like paper. Now, everything I have described so far is downstream. It is consequence. If you treat only what I have described so far, you will be managing symptoms for the rest of your life, buying stronger mouthwash and more expensive toothpaste, and getting the same lecture at every cleaning. So let us go upstream to the thing almost nobody addresses. You are not breathing through your mouth because there is something wrong with your mouth. You are breathing through your mouth because you cannot get enough air through your nose. That is the whole thing. Your mouth is not the problem. Your mouth is the emergency backup system, and it is running 24 hours a day because the primary system is obstructed. Your body will always choose to breathe. It is not going to suffocate on principle. If the nose is not delivering, the mouth opens, and it opens whether you are awake or asleep, and whether you consent to it or not. And your nose is not a hole. It is a piece of equipment, and it does at least 4 things your mouth cannot do at all. It humidifies. Air passing through your nasal passages picks up moisture, so what arrives at your throat and lungs is not the dry air of your bedroom. Breathe through your mouth, and that conditioning step is skipped entirely, which is exactly why your throat is raw at 3 in the morning. It filters. The hairs and mucus lining of your nose trap particles, dust, and a meaningful share of airborne pathogens before they reach anything delicate. It warms. Cold air is a known trigger for airway irritation and constriction, and your nose brings inhaled air close to body temperature before it goes any further. And here is the one that surprises people, including a lot of clinicians. Your nasal passages and sinuses produce nitric oxide, and you inhale it with every nasal breath and carry it down into your lungs. Nitric oxide is a vasodilator, meaning it relaxes and widens blood vessels. In the lungs, it improves how efficiently oxygen crosses from the air into your blood. It also has antimicrobial properties in the airway. Breathe through your mouth and you bypass that production entirely. You are still moving air, but you are moving it without the compound that helps you actually use it, which reframes the fatigue, doesn't it? If you have been sleeping 8 hours and waking up feeling like you slept 5, and you have already had your iron and your thyroid checked and been told everything is normal, this is worth sitting with. It is possible to be in bed for 8 hours and be breathing inefficiently for all 8 of them. So the question becomes, what is blocking your nose? Because something is, and it may have been there for years without ever announcing itself as a problem. Chronic rhinitis is common and often has nothing to do with the seasons, meaning you can be congested year-round without ever calling it allergies. The turbinates inside your nose, the structures that condition the air, can be chronically swollen. Long-term use of over-the-counter decongestant sprays can produce rebound congestion, where the spray that used to clear you out is now the reason you are blocked. A deviated septum can be mild enough to cause no daytime symptoms at all and still be the reason you cannot maintain nasal breathing while lying flat. Sleeping on your back makes all of it worse because gravity is working against you. And significant nasal obstruction can be the reason snoring turns into something more serious. That last point is where I want to be careful with you because it matters. Persistent mouth breathing at night, loud snoring, waking with a headache, waking gasping, or daytime sleepiness that does not resolve with more sleep can be signs of sleep-disordered breathing. And that is not something to manage at home with a mouthwash. Sleep apnea is significantly underdiagnosed in women, partly because women often present with fatigue and insomnia and low mood rather than the classic picture doctors were trained to look for. If that describes you, the correct next step is a conversation with your doctor about a sleep study, not a hack from a video. I would rather you leave here and make an appointment than leave here and buy something. But there is real ground between doing nothing and needing a specialist, and here is what actually belongs in that space. Start by finding out whether your nose is genuinely blocked, because most people have never checked. Sit quietly, close your mouth, and breathe only through your nose for 2 minutes. Notice whether one side is doing all the work, whether it feels like effort, whether you feel the urge to open your mouth. That is information, and it is information you can bring to a doctor. Saline rinsing is the least glamorous and most useful thing on this list. A saline rinse or spray, used consistently rather than occasionally, clears irritants and thins mucus without any of the rebound problems that come with medicated decongestant sprays. Consistency is the entire mechanism. Twice a day for 3 weeks tells you something. Once on a bad day tells you nothing. Address the cause of the congestion rather than the congestion itself, and that is a conversation with a doctor about whether you are dealing with allergic rhinitis, non-allergic rhinitis, structural narrowing, or medication side effects. Those have different answers, and you cannot guess your way to the right one. Change your sleeping position. Side sleeping and modest elevation of your head both reduce the tendency of the airway to collapse and the tongue to fall back, and both are free. Consider the air in the room. A humidifier does not fix mouth breathing, but it reduces how punishing each dry breath is while you work on the actual cause. Protect your teeth during the period when your mouth is still dry, because that damage is cumulative and permanent in a way the other symptoms are not. Xylitol, in gum or lozenge form, stimulates saliva and is not fermented into acid by the bacteria that cause decay. A fluoride rinse at low concentration, without alcohol, adds protection at the gumline where this pattern of decay shows up. And do not reach for a strong alcohol-based mouthwash to solve the bad breath, because you would be treating dryness with a drying agent. And there is good reason to think you would also be disrupting the oral bacteria involved in that nitric oxide pathway we just discussed. And now, the one you have probably seen online, which is taping your mouth shut. I am not going to pretend it does not work for some people, because for some people it does. But it is the wrong first step, and it can be the wrong step entirely. If your nose is obstructed, taping your mouth closed does not teach you to breathe through your nose, it just removes your backup system. If you have untreated sleep apnea, that is not a small thing. The order matters. Open the nose first, get evaluated if there is any suspicion of apnea, and only then consider anything that restricts the mouth, ideally with a clinician who knows your situation. Here is what I want you to take from all of this: the dry mouth, the bleeding gums, the breath, the decay at the gum line, the fatigue that no test explains. You have probably been carrying those to 4 different appointments and getting 4 different answers, none of which connected to the others. They may well be one thing, and that one thing is a mechanical problem with how air gets into your body, which means it is the kind of problem that has an actual answer rather than the kind you are supposed to accept. Which is a very different feeling than being told this is just what your 40s are.